Joining me now is the Democratic Congresswoman Barbara Lee of California. She serves as the co-chair of the pro-choice caucus in the House. And we should note the Congresswoman is a candidate for U.S. Senate in 2024. Congresswoman, I want to recognize that it's Black Maternal Health Week with you, with something that you tweeted yesterday. Quote, did you know Black women in the U.S. are 3 times more likely to die from preventable pregnancy complications than white women? This is systemic racism, plain and simple. We need policies that center Black maternal health and ensure all birthing persons have the care they need, end quote. According to data from the CDC, the maternal mortality health care rate for Black Americans is in 2021 was nearly 70 per 100,000 live births, compared to just 26 for white Americans. As access to abortion care shrinks across the country, and especially in the South, what would you like Americans to know on how this will affect Black community in particular?
Thank you so much for having me this morning, Maria. First, we know that this attempt to ban abortion, this move toward a national abortion ban, which is what this is now, will disproportionately impact Black and brown women and low-income women. You saw the map earlier with regard to the states, which for the most part have these very restrictive laws now that will either criminalize people who are making their own personal decisions about abortions, preventing them from traveling to other states. I mean, this is a real crisis. And once again, it just demonstrates the health inequities in our healthcare system. Once again, it's Black and brown women and it's low-income women who are going to be most negatively impacted by this.
Well, and if you saw the map, you actually look at most of those they're all red states, but sadly, it's also the concentration of the poorest Americans in this country, to your point. What implications do you think that this abortion ban will have on a larger political narrative? We saw that Ron DeSantis, at the dead of night, decided to sign this anti-abortion 6-week ban. But we also know that the majority of Americans do not believe in the 6-week ban and are closer to a 15-week ban. So what political implications do you think that will have on these ruby red states where, again, they're the ones that need access to health care, one could argue, the most because of the rates of poverty that you see there?
Sure. The reality is that people are going to be criminalized and abortions, for the most part, are illegal or will be illegal. It's taken away a person's individual personal decisions on how they want to handle their own health care. These decisions place government, judges, elected officials in the middle of such important personal medical decisions. So it's taking away reproductive freedoms, which once again is one step toward the radical right wing in this country trying to establish a national abortion ban. This is fundamentally undemocratic and it's wrong. And it's disproportionately impacting Black and brown people, low-income people, people who live below the poverty line in red states. And it's very dangerous what is taking place. This is a crisis. It's a public health crisis.
Let's go a little bit more, because I think oftentimes we see what the Republicans are doing in a silo. But when you string everything together, when we're talking about preventing people from access to abortion care, when you see these individuals also trying to prevent access to the voting booth in these same states that we outlined, you see book banning, you see them basically trying to promote not gun safety, but gun exploitation for the most part. What do you think of this idea of the Republicans, where in silos it seems innocuous, but together it's clearly an agenda that prevents people from exercising their democratic freedoms?
That's exactly it. Also, they're trying to prevent people from using contraceptives and birth control pills. That's one of their next efforts. And so what is taking place is fundamentally undemocratic. And this is really an attack on one's personal freedoms. Everyone should be up in arms because, as I say, they come for me today, they're coming for you tomorrow. This attack on trying to prevent medication abortion, mifepristone. I mean, this is outrageous. It's a safe drug. It's a safe miscarriage management medicine. What is going to happen with the FDA now in terms of the efficacy of the drugs that they're trying to do the research for and to provide for safe medicines for other kinds of medical situations of medical issues and medical decisions that people have to make. The drugs may or may not be available. So this has widespread implications, what they're trying to do as it relates to taking away people's reproductive rights. It really impacts so many other areas, and we have to really be very concerned and speak out and fight back.